Welcome back to more. So starting a family is a really big step, one of the biggest you'll ever make in your lives. But sometimes it's not always the easiest one to make. It's not uncommon for women to have a lot of difficulties getting pregnant. But here today with some advice is Dr. Paul Wilkes. You've seen him on our show before from Desert Prenatal Associates here. And Doc, thank you so much for being here. Like you said, Valentine's Day just passed, but people are still kind of celebrating the month. Let's talk about pregnancy and some of the things that people struggle with when they're trying to get pregnant.
So really the big decision that people have to make, the very first decision is, how do we get pregnant if we want to get pregnant, or how do we avoid pregnancy if we don't want to get pregnant? So let's talk about the don't want to get pregnant first. Okay. Clearly, 50% of all pregnancies are unplanned.
Okay.
So we don't want to get pregnant, what should we do? That people just aren't paying attention. If you have no medical contraindication or no religious contraindication to some form of contraception, then that's really the best way. You go and you see your physician, make sure you're healthy enough to be on those medications or barrier methods, and that's the best way to avoid getting pregnant. Okay? When you talk about, okay, now we want to get pregnant. We've made the decision we want to get pregnant. A couple things. One, get a checkup. Okay, go see your doctor, make sure you're healthy enough to be pregnant.
Get your levels checked, right? All your hormones, all
you want it, and it's not always a hormonal issue. So you need to make sure that your overall health is good. Okay. Second of all, get on a prenatal vitamin. The most important time for a prenatal vitamin, 3 months before conception to the first 3 months of pregnancy.
I have never heard that before.
It's the most important time, and people come in and they say, hey, I'm 8 weeks pregnant, I need to get on a prenatal vitamin. You're already 5 months behind the curve.
I have a confession? That's what happened to me. I got on it afterward, and I'm sure a lot of other women out there have done the same because you don't know this information.
Right, and you really want to be on a prenatal vitamin for 3 months before conception.
Okay, let me ask you this. Should women just take a prenatal vitamin in general for overall health? Because I was told that it's all about the iron. If you have a reduction in iron in your body for some reason, that it's good just to be on the prenatal vitamin in general.
Yeah, iron and folate are the two big ones for pregnancy. Folate helps to decrease the incidence of spinal defects.
Oh, wow. Okay.
And iron helps to avoid anemia, which is very common in pregnancy.
Okay.
So yeah, prenatal vitamin as your general multivitamin, fine.
Okay.
Absolutely.
All right. Now let's talk about, you know, we hear this all the time. 40 is the new 30. Now it's cool if you're talking about fashion or a new career and things of that nature, but when you're talking about pregnancy, is that true? Is 40 the new 30? Should women be waiting until they hit their 40s to do it? Well,
we've seen a lot of women delay childbearing for a number of different reasons, but you have to understand, once you cross that 32 to 35-year-old threshold, there are a lot of increased risks to being pregnant. Now, at Desert Perinatal Associates, we take care of a lot of women who are 35 and older and pregnant, and I would say 99% of them get excellent outcomes, okay? So I don't want women to say, I'm older than 35, I'm older than 40, I shouldn't have a child, because that's not accurate. But you do have to make sure that you're healthy, and you do have to make sure that you get the proper screening and diagnostic tests before and during pregnancy.
You know what, Doc, I think you're on to something. Women would probably have you talking for the next couple days, because there's a lot of misinformation out there on this topic. But thank you so much for shedding light on this. We appreciate it.
Oh, absolutely.
All right. Well, Rachel, your turn. I mean, go ahead.
Well, okay, I don't know how to answer that. I do want a baby one day, so I'll let you guys know if that happens. All right. It is one of